And we should be live in just a few seconds. All right, and we are live. So I want to welcome everyone to our Know Your Rights series. My name is Annabelle Santiago. I'm the grassroots coordinator with the Coalition for Social Justice. Thank you so much for joining us live today. I want to go ahead and share my screen really quickly. Here we go. And I just want to say that this series is brought to you by a number of different organizations and coalition partners in an effort to extend our reach and get you the information that you need in this moment. We'll be covering a variety of issues week to week, and you can catch us on Facebook Live or register through Zoom, and you can find the registration link on the Know Your Rights series event page. The way that this will work is we will start with a 10 to 15 minute presentation from our guest speakers from MassCOSH with time for question and answer toward the end. If you're on the Zoom call, you will remain muted until we go into questions, and also know that this is being recorded and we are live on Facebook and it will be distributed for later use. I will be fielding questions coming in through the Facebook Live and through the chat function of the Zoom call. And you may also use the raise hand function on Zoom to ask your question. So today I'm really excited to have Milagros Barreto, Rick Rabin, and Vega from MassCOSH, the Massachusetts Coalition for Occupational Safety and Health, with us here tonight, and they are covering the topic of worker health and safety, COVID related. So Milagros, Rick, and I'll kick it over to you. I'm really excited to have you tonight. So take it away.
Thank you.
Hey. Thank you, Annabelle. My name is Rick Rabin. I'm a longtime volunteer with MassCOSH, and we hope to give you a very brief, concise view of what your rights are when you go back to work, working in possible exposure to COVID-19. So can I have the first slide? Okay, so we are, and the next slide, that would be good. What protections are you entitled to? Well, in Massachusetts, the governor and a council that he's appointed have made up a series of requirements for employers at different stages of people going back to work. And so these requirements are essentially social distancing. Everybody's heard this term. In hygiene protocols, staffing and operations, cleaning and disinfecting. And the only requirement really for employers is that simply they say that they're doing this, they're doing these 4 things, and they post such a notice in their place of business. And you should know as an employee that if you see that there's a problem, you don't think your rights are being addressed, you can contact your local board of health. That's the way it's written. But we can tell you confidentially that we don't know that your local board of health is in really a good position to enforce these rules, but a little bit more on that further on. So the next slide, please. This is the poster, you might say, that you should be seeing in the workplace. And again, it's a self-certifying statement. There's really no enforcement unless possibly somebody makes a complaint. Next. So what should your employer really do? Well, first thing they need to do is find out what are the hazards, where are the hazards, and then make a plan accordingly. So what does the physical space look like? And where are workers going to be working? And what are they going to be doing? And what might be the transmission of these tiny particles or aerosols? Where are they going to go? And how much is there going to be? And what surfaces could be contaminated? You might see the word fomites there. That's just what are the contaminated surfaces. And what are the tasks that you as a worker are going to be doing that are going to put you at risk of getting COVID? So there are a number of protections that your employer should be putting in place. Personal protective equipment, PPE, keeping a distance of at least 6 feet, preferably more. Testing would be a really good idea, testing people, testing you periodically. And then training, making sure you know what the hazards are, what kind of PPE you should be using, how to use that PPE, right? And what can you do, what should you do if your employer's not doing the right thing? Next. PPE, personal protective equipment. OSHA has a standard that says your employer needs to assess what the hazards are, and then if personal protective equipment is needed, they're supposed to provide it free of charge, show you how to use it, how to take it, put it on, take it off, so that you have the best protection possible. And they're periodically need to train you. It can't be just this one-shot thing, and then for the next 5 years or 10 years, you're on your own. Periodically, they need to make sure that you know what to do and how to do it. Mm-hmm. And I think we go to the next one. Next slide.
Rick, if you want, I can chime in. And
Please do. It's your turn now. It's all yours.
Thank you so much for that information, Rick. And yeah, so once you have the PPE, you need training, right? In Massachusetts, all employers must provide training for workers regarding the social distance, hygiene protocols. In addition, employers should train employees on how to use the PPE, how to put and safely remove the PPE, like the gloves, how you're gonna remove the gloves correctly, the face mask, the respirators, that have a way to remove it, because if you don't do it that way, you're gonna be contaminated anyway. So it's very important that every employer in Massachusetts give this type of training when is PPE, which is personal protective equipment, in place. Can I have the next one, please? And enforcement of safety standards. If your employer is not meeting the mandatory workplace standards when it's applicable, the industry-specific standards, you have 3 options, right? Like Rick mentioned, you could call your local Board of Health to issue a complaint. And if you live in the Boston area, you could call 311. Also the Department of Labor standards, you could do a complaint there. And also you can call or issue a complaint through the hotline and form through the Massachusetts Attorney General Fair Labor Division, which is all these three, well, except the calling the 311, you could do this calling or doing online. Unfortunately, we haven't heard a lot from OSHA, which is the the Federal Agency for Occupational Health and Safety. They're being missing in action, like we've been mentioning before, because they don't have the resources right now, to go over these situations based on COVID. They don't have enforcement. They could be given some advice, but nothing for enforcement, the law. So this is something that you can take into consideration if you have any situation or health and safety in your workplace. Next. You're in mute. You mute, Al. Not that we can hear you. Yeah. Next slide, please. Go. You're mute.
Can you hear me?
You can go.
I've never known Al to be mute, Yeah.
Sorry about that. I just wanted to add a little bit of information on some of the statistics that we just quickly know so far about complaints that have been made to the Attorney General's office that I think shows to maybe a little of the lack of enforcement, but also just how concerned people are around being safe during this pandemic. So we know in the last 4.5 months, there have been over 2,000 individual complaints have been made to the Attorney General's office, which have made over 6,000 individual complaints, which have connected to social distancing, lack of PPE, but there's also been there for people who have been asked to work by their employer when they have symptoms, and also retaliation for speaking up about feeling unsafe in the workplace. And so just wanted you to all know that we do need to continue to make sure that when we see things happening, that they are being made aware of what's happening out there, because that's the only way we're gonna be able to show what industries and places there's potentially for outbreaks and potential for workers to really get sick.
Yeah, thank you. That is why it's important to continue doing these complaints, doing each the all this the situations, and you can do that also in OSHA website. You could do it. You could call. You could do it online, because like you mentioned, we need the data. If we don't do these reports, we're never gonna have the numbers. Next slide, please. So in MassCOSH, we have this resource that we call the toolkit for essential workers. This is very important piece, a tool like the name represent. We have this in our website and MassCOSH.org. You could find it also in our Facebook page. This is in English and Spanish version. This is a questions and answer for all these essential workers out there in different industry, in cleaning, hotel, restaurant industry, a lot of industry that they're being called to go to work first and then the others. And it's very, very important tool. If you have questions, you could just go right there directly. Yeah, and I hope you could get a lot, find whatever you need there, or you can contact us. We're gonna show our phone number and information after we finish the presentation. And it's a mute again. I think Annabelle, you need to unmute. You can hear you.
I'll set now?
Now.
Yeah, so I just quickly wanted to add here that one of the key things in this toolkit is that it also talks about kind of the opportunities to really organize around safety and health. There's examples there of seafood processing workers in New Bedford who raised safety and health concerns and were able to get their local board of health to actually shut down some facilities and improve conditions before they were asked to go back. And I think that that's one of the key things here is that we know that at the end of the day, your ability to organize with your coworkers is really going to be the strongest way to achieve safe and healthy workplaces. And so, you know, if even organizing towards unions is something that I think we're also hearing might be something that workers really want and need in these times. And so that's something that we also can help you connect with other labor organizations and unions if that is something that you would like support around it. So just wanted to add that and really pitch that these tools have also been updated to not just essential workers, but it's for all workers now. So there's numerous industries in there. And so really, really do hope that, Annabelle, if you can actually share those two links at the bottom of this image, I think that would be great. And maybe just leave it here for another second before we wrap up with the final slide. Is that okay, Annabelle?
Yeah,
Perfect.
just leave it up for a second so I can copy them.
Great. So in the next slide, I would like just to share with all of you our information from the Worker Center. If you can, whenever you have a moment. Yeah, pass to the next one. We are the Worker Center in MassCOSH. We are different programs, and this Worker Center is here to help workers with documents, without documents, with a status, no status, with union, not a union. And it's very important. These are our numbers and direct numbers, and you can call us. And if you have any situation of workers' compensation, wage theft, unemployment situation, sexual harassment, discrimination, retaliation, as Al mentioned before, if you feel that you've been retaliated because you were COVID positive, that's something that you need to step up, right? And tell what is going on. Maybe your co-workers are feeling the same. You know, they're feeling they've been retaliated, they feel discriminated. And this is something that organizing begins talking among your workers, your co-workers. So it's very important that you write down those numbers. Whenever you need questions, we're here to help and support. Don't be afraid to speak up and exercise your rights to a safe and a healthy workplace. We all what we've been talking right now is based for Massachusetts laws. Only the OSHA, which is the federal agency, is around United States. But what we like to always point out that this is only for Massachusetts. So I'm happy to help anybody if you feel like you've been going through any of these situations. Yes. Next slide. Any questions? Any in the chat, in Facebook chat, or any other comments you would like to share?
And I'd just like to remind folks, if you have a question, please put it in the Zoom chat. If you are watching by Facebook Live, you can just comment, and I'm keeping track of questions coming in through there.
Yes, we unfortunately we've been seeing a lot. We are going to continue seeing a lot of discrimination because people is contagious with COVID, people is positive, and then when they have the negative test and want to go back to work, they don't want to, they say, oh, I don't need you anymore. And it's people that have been working there for 7 years, 10 years, and you obviously feel it's not correct. So this is a new era. Nothing is going to be the same as it was before. So don't stay quiet. There's research and just ask questions. It's important.
Yeah, I think the only thing I would add is that we are definitely hearing already that, businesses from, hospitals to, poultry warehouses are doing everything they can to fight liability around people getting sick in their workplaces as people continue to work through the pandemic. And so that's something that we're continuing to fight in terms of occupational presumption. So really making sure that as workers need workers' compensation down the road because of COVID-19 infections, or in the worst cases, their family needs funeral benefits, that they actually can access that. And so that is something that we are also kind of on the front lines and making sure that we hear from workers and that those stories and their experiences are informing our decision makers to really think about what they can be doing urgently to help workers in these uncertain times. So not sure if there are any other questions that have come in. I know we left about a 10-minute segment here at the end of the night to make sure if there was anybody that had any particular questions in the chat on Facebook. If you want to unmute yourself, maybe I would even open that up as well. Sure, it looks like we got a question. So somebody wants to know, has a general workers' rights question. Olivia, do you want to, sure, I think, is it okay if we unmute Olivia?
Should be able to, there you go.
Thank you. Thanks so much. I appreciate it. Thank you for these resources. My question is for retail jobs. And this is a question that comes from my students because I'm a high school jobs counselor. And a student had a question where one retail job, she had a part-time retail job at one store and then was accepted to a job at another store, but they told her that she had to quit the old job so that she could be available for any hours at the new job. Is a store allowed to make that requirement for an employee that wants to work there?
Yeah, unfortunately, we see that a lot. That's a private of her time, you know. How do you say that? They just trying to keep her available the whole day, and sometimes they don't even call the workers, and that's not correct. It's not. It's unfortunately it's a decision that she has to make, because it's not that the law says that they can't do that. That's a decision that she needs to make, but it's not correct. That's not correct that she has to be available for one employer and quit the other job. That's not correct.
Thank you. Just to make sure I understand correctly, basically, a job can hire you on the basis of your availability. So they could tell you that they're only going to hire you if you're available for any hours. Is that sort of why they're able to do that?
They doing it to see if the worker accept those conditions, but there's nothing under the law that said that they can do that. But there's nothing under the law that said that they cannot do it.
I see.
Yeah, so yeah, it's a decision, a personal decision. But yeah, we see that a lot, and it's really sad because it's you know, probably, you know, it's put you in a bad situation.
Thank you so much.
Yeah, I'm going to actually take this time to also plug our Teens Lead at Work program. So we actually have a youth program where we hire 14 to 19-year-olds specifically to learn about safety and health in the workplace, around child labor laws, and then lead these trainings for other young people as well as employers of young people. And so definitely, if anybody has young people that are interested in getting more information about their worker health and safety, connect with us afterwards as well, and we can help with that too.
Al, Milagros, and Rick, just wanted to ask really quickly if you could share again, how can people get in touch with you if they have further questions? Or they're watching this video not live.
Okay, yeah. Why don't I think if we go to this next slide, I think there's a bunch of information. Yes, there's a bunch of stuff here. So this is our Milagros. You wanna plug this page really quick?
Yes. So this is the MassCOSH Coalition for Occupational Safety and Health, and the website www.masscosh.org. We are located in Dorchester Ave. We're not working like regular hours, but you could anyways contact us. That's our phone number. We also have a shared space in East Boston for workers that live, you know, more in that area. We're not doing it because of the COVID, but we're still working with the workers. You just call and we can, you know, make an appointment, and we continue doing the job from home. So far until, you know, whatever is going to happen with this pandemic. But yes, and also you could follow us on Facebook and Instagram and Twitter. MassCOSH.
If you go back 2 slides, I think you can show that the 2 number there. There you go.
As well.
Those numbers as well.
I was putting those right in the chat right now too, sharing those.
Those numbers are our hotline, direct hotline. Those are cell phones numbers. So you can, anytime you can call.
Not anytime, but.
Yeah, I was gonna correct. Thank you. Yeah, so it was supposed to be 9 to 5, but if you just call us, send us a text with any questions. If we don't pick up the phone right away, we're gonna call you back as soon as possible. But those are the main numbers to make it, you know, if you have any questions about any situation at your workplace.
So I know we're approaching that 7 o'clock hour. So I don't know if there's one last question. If not, I was gonna have Rick maybe just start us off to sign off this evening and thank folks for being with us for our quick but informative training session.
Just did one last sweep on Facebook and there's no questions there. If anyone here has any.
Right, not a problem. Okay, so I think I'm gonna leave up the last slide with our information for folks. Again, want to check out our website. But Rick, do you want to say any last words?
You know, I just want to say that if you look at the left side of that slide, that kind of tells you what we are all about. We not only do we give trainings like we're doing tonight, but we organize people. We want the public, we want our legislators to know that workplace health and safety is not optional. It is something that everybody is entitled to, and we are active, very active in making that happen. So thank you for coming, and feel free to contact us again.
Milagros, any last words before we sign off?
Yeah, don't stay quiet. Step up for your rights. Any trainings, OSHA, health and safety, workers' rights, we're here for you. And I hope we can help you in the future. Thanks for the invitation.
Great. And I will just quickly say, you know, we believe that every worker deserves to go home after a day's work, never injured with an illness, and in the worst cases, die as a result of simply trying to provide for their families. And that's what our organizations like the Coalition for Social Justice, what we at the Massachusetts Paid Medical Family Leave Coalition and Raise Up Massachusetts are all about ensuring that workers have rights and benefits, good wages, and deserve, you know, to live a good living. So even in the craziest of times, we're always going to keep fighting for that. So thanks so much for joining us tonight.
Great. Thank you everyone for joining. I just want to say, looking forward to seeing you all next week, and I am taking off the Facebook Live. Have a great night, everyone.
Okay, good night.
Yeah.